Welcome and aloha, our first show, Boritzer's Bio Briefing. My name is Rafi Boritzer. We're going to be talking about biology, biotechnology, bioethical behavior, biomedics, everything with bio, everything with medicine, everything with healthcare. This is our premium show, and I welcome you to be my guest this afternoon. I'm not entirely by myself. I must admit that I have a friend with me, my iPad. My iPad is always with me, and things have changed very much since I first arrived on the Hawaiian Islands. Actually 50 years ago, in 1964. It was not my first visit, but my first long visit that was beyond 12 hours. My first visit had happened 2 years prior as a young merchant marine cadet in the Israeli Merchant Navy. We had hit a sandbar in Panama and consequently had to stop for fuel on the way to Japan. And the only place in the middle of the Pacific, as you well know, is right here in Hawaii. And I spent a whole night walking from Coco's to Diamond Head. Coco's is the old coffee shop that turned into Hard Rock Cafe later on. Became all sorts of rental properties for all kinds of purposes. I don't know what they're doing there today, but it was in that time an adventure to get to know Hawaii for the first time. So consequently, that's how I met Hawaii. 2 years later, I came to study at UH, studied sociology. My claim to fame is that I'm a defrocked sociologist. After spending 3 degrees as a sociologist and graduate work in Hawaii, where I am happy to say that I went with quite an elite retinue. I remember the teaching assistant at the time was a gentleman who went on to become a taxi driver, and then I lost track of him and along the way, and he became the governor of the state of Hawaii. So things happen. If you don't look around, you could be corralled in becoming a politician. That did not happen to me. Another gentleman at the time was Vernon Wu. Vernon Wu is a successful attorney in Honolulu, was also a family court judge. And so I guess all big successful careers start with studying sociologists. The rest of my story you'll get to know over the meetings that we have together, but our purpose today is to examine all types of, as I said, medical, health, and biological phenomena in the world, especially those that have a direct relationship to Hawaii. We are going to be examining issues that range from biology to medications, to biosimilars, to biological ethics. We're going to be talking about the Affordable Health Care Act. We're going to be talking about healthcare systems from Cuba to Israel and many countries in between. We're also going to be talking about the future of inflammatory disease and the consequences that Hawaiians are particularly sensitive to from overeating, obesity, and the incidence of diabetes. So we're going to start by talking a little bit about the role that diabetes and especially obesity, one of the major causes or co-inhibitor of the diabetic problem in Hawaii, is causing such concern. Perhaps research. Additionally, the situation requires government intervention. But first and foremost, we're going to be talking about the fact that behavior change is a critical component of making sure that we don't have the disaster, not only in Hawaii, but nationally. I'm very fortunate. About 3 years ago, I was part of a research team that was funded by the Centers for Disease Control and under the auspices of the Michelle Obama Initiative, which, as you know, concerns exercise, healthy eating, came up with a program which was primarily focused on Maui and Kauai because it was addressing rural issues of Native Hawaiians. We're going to be talking a lot about Native Hawaiians, and in a few minutes I'll also tell you about some of the things that have to do with Native Hawaiian health and medicine. We're going to be meeting and introducing you to some of the key players in the arena of Native Hawaiian health right here in our Hawaiian. I'd like to also invite my guest today. He is actually not only a guest, he's the owner and the proprietor, if you could call it that, of ThinkTech Hawaii. And I'm going to ask you to stay tuned. Give me a couple of minutes to prepare the hors d'oeuvres, the full plate, the Kalua pig roast, and then we'll be able to introduce you to Jay Fidell. So let's take it for a minute break. We'll be back in 60 seconds.
Aloha. I'm Nicole Horry with the ThinkTech Commentary. The PUC has established an investigative docket to determine the advisability of an undersea cable connecting the Oahu and Maui electrical grids. It has scheduled public meetings on both Oahu and Maui to invite comments on the proposal. The PUC is investigating whether a transmission cable between the two islands is in the public interest and whether the benefits to ratepayers would exceed the costs of the cable, which DBET estimates would be $700 million. The PUC also wants to know about development risks and how they would be mitigated. With the remarkable increase in PV in the islands and the availability of new grid technologies, it may be possible for each island to generate renewables that meet its own demand, and to have separate renewable grids for each island instead. At the same time, an island that depends heavily on a source of renewables, such as PV, may be vulnerable to local changes in the weather or an unanticipated problem with that single method of energy generation. The ultimate question for the PUC, then, is not simply whether an undersea cable is good for Hawaii, but how we can achieve layered redundancy for a resilient statewide system. ThinkTech believes that a great state needs ample power distribution, and that the proper approach is to start with this undersea cable, not only to bring the separate island grids and the state together, but as part of a strategy to achieve the security and safety of redundant systems. I'm Nicole Horry with this ThinkTech Commentary. Mahalo. Aloha. I'm Nicole Horry with the ThinkTech Commentary.
Back through the magic of television. Isn't television wonderful?
Yes, it is.
Soon it'll be gone. What will we do then? We'll just have to wear our special sunglasses, go to boring lectures, and watch a tube to a little chip right over our eye.
It's all going to be on the internet.
It's
Rafi.
all on
Everything.
the internet.
It's
We are going
coming.
to stop actually living in a biological sense. We're just going to be little figments of the internet's imagination. We're going to be the byproduct of internet cogitation.
What was that movie with Tom Cruise, and these people lived in a tank,
Yeah.
and they didn't do anything, just sort of floated in the tank, and their minds were operating. It was all about getting a good signal from their brain. That's what
Well,
it's
you know
going to
what?
happen.
Before we get into our main meat and potatoes, I want to tell you something. I predicted about 20 years ago, and I have witnesses, and I said that the world is going to have to prepare for a generation of people, a certain segment of society that is going to do nothing. And I think we're reaching it much quicker than I anticipated. The talk seems to focus on the healthcare, but the healthcare is just another side issue because a lot of these people are going to be ill, but a lot of these people are not going to have the skills necessary. And we're going to be talking about skills. We're going to be talking about the fact that one of the big job opportunities, not only in the world, but especially in Hawaii, is medical care, medical services, services to the disabled. And the society, though, has to be prepared. With all due respect to the Republicans, and I know the previous show that I just came after is one that espouses a more less governmental role in society, but I think it's not an issue of governmental role. I think that as a society we have to make a conscious decision that are we going to take care of those segments of society that simply can't take care of themselves. I mean, the other option is to do, basically what the despotic regimes during World War II did. just eliminate people who are not deemed to be used to society. And I think that this is a real philosophical question. Why do I bring this up? Because I think the whole issue of bioethics, medical ethics, we do discuss it, but we seem to avoid in America talking about ethics in general, ethics of economic behavior, the ethics of the material world, the ethics
of medicine. You know, remember 1984, George Orwell, right?
Yeah,
well,
of course,
it's the, what
of
is
course.
it, the 30th anniversary of that?
Yeah,
It was
right.
the 30th anniversary. Yeah, 30th anniversary of that. And if you remember, in 1984, people were terminated at the end. You know, when they were no longer considered
Right.
useful for society, they were sent away somewhere.
But you know, Wigga, I want to talk a little bit today about future discussions in bioethics, since I teach bioethics and medical ethics. And the question, when to disconnect the lifeline, and when do you deny medication? What kind of medication
It's a
do you
huge
give?
problem.
But the real question is, this is a subcontext or a subtext, if you like, of the bigger question, and that's the question of what do you do with people who have nothing to contribute to society, not necessarily because of their own fault. Some of it is their own fault, but some of it is conditional. You're born into parents. You know. I don't know if you remember when you were small, but when you got into a fight with your parents, you'd always say, "I didn't ask to be born." Did you ever say that?
No.
Oh,
Sorry.
I did that actually. I did say that to my parents when I was particularly angry.
They would say to me, you know, we shouldn't have had you.
Ah, no, they never said that thing. My parents never said that, when I get angry, they say, why didn't you do this or didn't do this, or did you get a terrible grade on your homework and this? I said, I didn't ask to be born and to be put into that. So the question is, what do you do with people who really didn't ask
But it's
to be born?
getting to that. I mean, I think your point is so well taken.
Yeah.
It's getting to that. You know, we have become a world, or at least a country of consumers, and all we know how to do is consume. We don't know how to produce. You know, there was a piece about in the New York Times yesterday about if you thought that American manufacturing was up again, think again. It's not up again.
Right. I saw that in the New York
So,
Times.
you know, as a society, we're becoming less productive, more consumption-oriented all the time. And if you keep going down that trail, where do you wind up? The world owes you a living. My parents said that to me, too. The world does not owe you a living. You have to do it yourself. And as a
Yeah.
country, the world doesn't owe you a living either.
But I'm saying, what if you're raising a generation without any value structure that says that the world doesn't owe you a living? Then you become, many times you become feeling entitled that the world maybe does owe you a living. But the question is, where does this get
Maybe it does.
interjected?
Maybe it does.
Maybe it
As
does.
a matter of humanity, maybe
Well,
it
let
does.
me ask you something. Let's just ask in terms of bioethics again, because I always come back to it. What do you do with someone who is lacking in medical faculty, so you can't even say he can learn the value system or he can learn a particular skill? What do you do with that person? Do you practice eugenics? Do you practice euthanasia? What do you do? And no one wants to talk about it because, God forbid, excuse me, we use this expression a lot in my culture, but God forbid, this question should come up.
You know, about 2 years ago, 60 Minutes had a very interesting, you must know about this, program about all these people in the country who are all on tubes. And their family, for largely religious reasons, wants to keep them on tubes, but they're blotto. Okay, and they have no insurance, and the government spends $10,000 a day keeping them alive, and the family says, no, don't pull the plug, don't pull the plug. Well, the answer seems pretty simple in that case, to pull the plug. You know, they're just and it's an unbudgeted expense on the part of the federal government. Nobody knows how much it's going to cost in a given year or next year. And so, this seems clear that sometimes you have to pull the plug. So I think this is a work in process. This application of eugenics and what's the other one, euthanasia, it's going to come. It's going to come.
Well, the question is also, I personally thought there was a much better solution many years ago, and to the issues of divorce and breakup of family structure and so on. I truly believed, and I still to some degree do, that people should take out driver's licenses, that they cannot get married or have children prior to passing a certain amount of training or education, just as they do, but they cannot drive their car before they have some practice in
You're
passing
absolutely
driving
right.
test.
Same with having children. Boy,
Yes.
that's really a lot of people out there have children and they're not qualified.
And even if we sidestep for a minute the discussion about contraceptives and abortion and put that aside for a second, what about the public health education, just as we used to have, and I think some schools still have that kind of education, but you must start it earlier and earlier, because with the internet and with television, with mass media and word of mouth, and contraceptives and all kinds of other issues that are not really directly related, children are having sex with other children more often than not. So you have consequences. So what can society do as a public health entity or public health controller?
Education.
Right. So it always comes down to education. The question is, that I raised at the beginning of our discussion, is what do you do free education? And that will bring me to one of my big axes.
Well, the answer is yes.
The answer is that if you're going to have children, you must have a license. And number two, I call it 0 to 5. And if I do in the next 20 years another show nationally, internationally, it's going to be called 0 to 5. Because that's where it matters. Without 0 to 5, you are losing your children. They're going to that never land in the sky where you have no control, you have no idea what they're doing, and when they're suddenly 20 and you see them perhaps brandishing an AR-15 in some hallway, I said, yeah, I didn't know. How did I know? I have no idea. I had no clue. Well, you know what? That starts to sound a little disingenuous.
It
when
does.
people, after 20 years of having a child, they had no clue that there was
It's
a
the latchkey
problem.
thing. You don't pay attention to them, you get what you get.
Yeah.
There was a thing on 60 Minutes just last night about he was running for governor of some state in the South, and his kid had mental problems, and he tried to get his kid in a hospital bed to be treated.
Oh, I saw it. The
You see
lack
that?
of mental health services.
And there was nobody there to help. No
There is
psychiatrists, no beds, no
We're
nothing.
going to be talking about this because we're going to be talking about some of the biggest ethical issues and what has spawned a variety of healthcare systems around the world. People think in America that having the Affordable Care Act is some kind of a revolutionary thing. No, my friends, this is the tail end of some of the less comprehensive systems around the world. That's a little tail. You haven't seen really good healthcare. And we're going to be talking about two good healthcare systems during the course of this show. We're going to be talking about Israel, which you would expect because of the 33 Nobel Prize winners out of a small country of 8 million people. But on the other hand, you're going to find out that Cuba is right up there. After all the embargoes and everything else, the 1956 DeSotos running in their streets, ambulances with 1937 Chrysler engines, and they are at the top with the same longevity as Hawaii, ladies and gentlemen. So tell me, is it communism is good, or Cubanism is good, or Fidelistas make sense? Maybe, maybe not.
Being
Maybe
smart is good.
Being smart is really good. And we're going to be, one of my big axes, you're going to find, I will bring a big axe to the program from now on. One of the axes that I really like to grind is the 0 to 5. If you're doing the job 0 to 5, and here again, even though I'm an avowed social capitalist, I would call myself, having been raised early on in the kibbutz, especially in the summers with all my cousins, where we learned that, your parents didn't necessarily have the final word. Maybe the kindergarten teacher in the children's house where you slept had the final word. But maybe there's certain aspect of social construction of your reality and institutions that makes sense.
This would be pretty interesting.
Especially if you have parents who spend no time with you. So why not grow up in a children's house somewhere?
There was a big revelation about life in the kibbutz a year or two ago in the paper, and somebody wrote a book about it, about how you didn't spend time with your parents. Your parents were your friends.
4 to 6 every afternoon. You left the children's house and went to your parents' apartment.
The rest of the time you were with your peers, you were with your teachers, and your parents simply were not that influential in your life.
That's right. But there are the repercussions. And the repercussions show up when you grow up. When you see your friends from the city or your cousins from the city, and they've gone up to become professors, Nobel Prize winners, politicians, so on, and you're still picking grapes from the grapeyard. You know, there's something there. Maybe the kindergarten teacher and the house counselor in the elementary school when you slept with all the other children and after you saw your parents for 2 hours, maybe those values about aspiring for education and achievement and so on didn't get transferred. So, you know, I was just pondering that, and I was looking at all my cousins who are now second and third generation in the kibbutz, and the ones who grew up in the cities or immigrated to
So
America.
what's your judgment on it, Rafi?
My
Which
judgment,
one is best?
I think an integrated model is what you're going to end up with.
You mean
I
a
think,
compromise?
Yeah,
Both.
a compromise. I think you cannot ask or believe or expect that a single parent mother, let's say in a typical poverty to low middle class neighborhood, who goes to work for 12 hours a day, is raising 1 or 2 children, okay, is going to come home and have a lot of patience or skills to spend on her child or his child, and be able to raise it and give it the values and the motivation and the contacts and the networking and all this to succeed. You're just raising one generation the same after another unless there's some
Not making
intervention.
progress.
Right. And so perhaps the kind of, if we are now cognizant of the fact that society is made up of a lot of single parents, maybe it's time to institutionalize the child care much earlier.
Gee, I think it's really a good point. You know, years ago, the home was the hearth, you know, and Dad would sit at the dinner table and be at 5 o'clock, and you'd be there, and then
That's right.
and whatever things were happening, you'd have to explain to him, and it was a real family connection. But now everything is latchkey, and they work 3 jobs a day.
Right.
They don't have any time for you. And boy, you really need peers, and you need help.
You know, and I don't want to sound like an embedded academician without a 1% retirement plan out of Wall Street. But I want to tell you that all those people who are perhaps in the upper echelon, the 1%ers, I don't think they ought to be sleeping just that calmly at night. Because I don't care what security system is. You don't have a life if you have to live behind fences, as I saw in Mexico City, as I saw in Caracas with the rich people, and I saw in some other wealthy bipolar society in terms of wealth.
Bipolar society.
But I want to spend a little time also on where the show is going, and I wanted just to get comfortable with my audience and with ThinkTech audience to talk about major issues. We are not limited to straight doctrinaire medical issues. One of the things that we are going to focus on is some of the big issues in Hawaiian healthcare. We're going to be talking about native Hawaiian health. Now, I know that there are some people who perhaps haven't spent as many years as you and I in Hawaii who don't understand, who think that this is a tangential issue, but some of the issues we just talked about affect the native Hawaiian population just as much as any inner city, even though we don't have too many inner cities except maybe Kaka'ako, and that's changing pretty quickly. And that used to be an inner city, especially after 11 o'clock at night 20 years ago. You didn't go around there to pick up the impounded car that was towed away from Waikiki without an escort. But that's another story. What I do want to mention is that the Native Hawaiian issues have to do with some of the national issues. And the interesting thing is how the colonial history of Hawaii and the colonial history in Africa and the colonial history in South Asia shaped the very health issues we talk about. You know, and the problems didn't just arrive yesterday. And the problems aren't unicausal, that we can say, oh, Captain Cook did this. Yeah, Captain Cook brought a lot of diseases. But there are people also in the Black Plague in Kolkata, where I visited in 1993, also who brought some issues from other places. Everybody brings issues. People who are traveling and migrating bring a lot of issues. And we have to be cognizant that this happens. But what are we going to do about it? And what I find that the situation in Hawaii is so unique about the health issues of obesity, diabetes, inflammatory disease, and chronic illness is that it's solvable. We have a crucible here. We have a test tube. We have a laboratory. Okay? And the native Hawaiian health systems, whether it's at the John A. Burns School of Medicine, whether it's the various groups that we're going to invite to come here and discuss this, they are chartered in 1988, 1989 through the Native Hawaiian Healthcare Acts and so on to promote healthcare. What can be done? What are some of the ideas? What are some of the integrative pathways to solving these issues. They will require issues. It doesn't stand alone from community development. It doesn't stand alone from income earning. It doesn't stand alone from education. It all is a totally integrated concept. And to look at each issue as if it stands by itself, we can solve this problem and not solve the other, is to live in a la-la land. That's the only way I can describe it. It's kind of a remove. Why don't we take a little break and gather our thoughts before we start going into some of the issues that we're going to be looking at over the next 12 months. This is Rafi Boritzer. We'll be back in the shortest amount of time possible.
Aloha. I'm Nicole Horry with the ThinkTech Commentary. The PUC has established an investigative docket to determine the advisability of an undersea cable connecting the Oahu and Maui electrical grids. It has scheduled public meetings on both Oahu and Maui to invite comments on the proposal. The PUC is investigating whether a transmission cable between the two islands is in the public interest and whether the benefits to ratepayers would exceed the costs of the cable, which DBET estimates would be $700 million. The PUC also wants to know about development risks and how they would be mitigated. With the remarkable increase in PV in the islands and the availability of new grid technologies, it may be possible for each island to generate renewables that meet its own demand and to have separate renewable grids for each island instead. At the same time, an island that depends heavily on a source of renewables, such as PV, may be vulnerable to local changes in the weather or an unanticipated problem with that single method of energy generation. The ultimate question for the PUC, then, is not simply whether an undersea cable is good for Hawaii, but how we can achieve layered redundancy for a resilient statewide system. ThinkTech believes that a great state needs ample power distribution, and that the proper approach is to start with this undersea cable, not only to bring the separate island grids and the state together, but as part of a strategy to achieve the security and safety of redundant systems. I'm Nicole Horry with this ThinkTech Commentary. Mahalo.
And we are back. You're hot. We are not, but we're going to get hot pretty soon. And I want to tell you something. We talked about the issues of the health problems plaguing the Native Hawaiian community. As I said, it didn't start with Captain Cook, but it's certainly been aggravated by the history of the colonial history of Hawaii, the colonial history of Africa. I'm quite familiar also with the histories of West Africa, having spent some time there as well. And see what can happen when you don't nip problems really early on. As technology evolves, as industry evolves, as societies develop economically, there's less and less resources for people who are suffering the most. So, as I was starting to say before, I was rudely interrupted by the break, which was so necessary to let our sponsors see themselves on the tube. But what I wanted to talk about was a CDC grant that we received, as I said, from the Michelle Obama initiative to try to put a dent in obesity into the consequential chronic illness, especially diabetes. And part of my research was to develop at least patient-targeted sustainable incentive for the highest at-risk demographics. We've all hear about incentives all the time. You watch television, they say, if you go and redeem this coupon, if you go right now on the Costco site, if you buy in the next 24 hours, all incentives to get you to change your behavior. So I said, you know what, doctors get incentives. Doctors get to often travel on trips and conventions and present papers at the expense of some pharmaceutical company. How do they get this? How does this happen? Well, if a physician writes a prescription on a particular drug or something, the rep from that particular company follows that trail and says, oh, Dr. X has been, recommending Viagra over Cialis by 6-1. And Viagra is our product. I won't mention the manufacturer, of course. But so obviously he deserves it. So the next time there is a talk about Dr. X's specialty, there's a convention, he gets invited either to present the paper at the expense of the pharmaceutical company. So I said, if the incentives are good, why not give doctors incentives to also see if they could put a dent in the diabetes and obesity issue? That certainly came up in the discussions in the White House, and Michelle Obama got all the money pushed into the CDC based on that assumption.
Incentives like what?
So that's the question. So we know that doctors have incentives. So the doctors' incentives under the system of healthcare in America is to see as many patients as possible. Okay, so you get what we call factory treatment. You know, crank it out, piece per visit, you know, $20 per visit, whatever. Crank out as many. You have 12 waiting rooms. You circuit the waiting rooms. And I don't blame the doctors because the system of incentives is set up that way. How do we change incentives? So I thought, wait a second, we are talking to the wrong people. The doctors are not responsible for the obesity, and they're not going to be responsible for the solving of the problem. Where does the problem reside? The problem resides right with the patient. That's where the problem resides. Am I right, Jay, or not?
Yes, you're right.
Okay. I rest my case.
Don't get too excited.
I rest
about
my
this.
case. Okay. So, if the problem resides with the patient, how can we incentivize the patient?
Wait, why don't we look at the doctor first?
Let's leave the doctor out of it. Let's look at the patient. Let's see what, you know what, the patient didn't get there because of the doctor.
That's
the
true.
patient got obese because of a lot of factors, Coca-Cola and McDonald's and easy fixes, the American solutions that everything can be fixed easily with a pill or something else. So there are a lot of values issue, industrial issues, economic development issues. Companies like Pfizer and Johnson & Johnson made lots of money from having all kinds of drugs that good only for 65, 85, or 75% of the people based on the threshold of the clinical trials, blah, blah, blah. We'll get through all this. We know the game. The question is, how do I get you to change yourself? How do I get you to change your behavior? What can I do? Do you want my firstborn? Do you want my wife? No, I can't give my wife. I'm sorry. You can have my... forget the firstborn also. But what can I do to make you change your behavior? What can I do to make you not stop at the next Pizza Hut just because they're puffing up a cloud of pizza smoke up the chimney as you pass by, and you haven't eaten since 8 o'clock this morning, it's now 2 in the afternoon, and suddenly your endocrine glands are telling you, I gotta have some sugar in my body. I gotta have it now. But maybe it's only 11 o'clock in the morning, you already feel that way. There's something wrong with what you had for breakfast. Oh, you didn't have breakfast? So what can I incentivize you with? What do you think our study, our research in the field, by the way, this was a pure applied research project. We did it in the field for 3 years. And what do you think we came up after? We didn't ask the doctors. I didn't provide the solutions. But I asked the people involved, the Hawaiian community in many respects on Maui, who get their medical services from a medical hui in Hawaii under one of the grants I just discussed before. And what do you think they said? What do you think, Jay? What do you think were the top 20? Okay, give me the top 2.
About how to incentivize people?
How do I incentivize them to change their eating behavior and to change their exercise behavior?
With money.
Okay.
With
Jay,
money.
Jay, thank you. You weren't a malpractice litigator, were you?
Just a business lawyer, that's all.
Just a business lawyer.
But what do you think contracts are about?
So, yes, true, money was one of the top. There was also gym memberships. We know how those don't work. But money was on top. And let's even assume that money would work. But you know what would happen? The minute you cut out the incentives, the behavior would go back to where it was. So there's something wrong with the incentive model. Okay, the incentives have to be, first of all, what I came to a conclusion, that the incentives have to be long-lasting, affordable for the society, sustainable by the society, and also intervene at a much earlier time in the object that we're studying. And that brings us back to education, brings us back to value systems. What role does society have in intervening? We talked about before about the kibbutz system, about the roles of values, what values.
Suppose I take this white paper person, and he's very young. And he's in a, call it a kibbutz kind of system where you have multiple vectors influencing him. And every vector says the same thing: stay away from pizza. That's going to work, right? Because it's that 0 to 5 thing, right?
Right, especially if you show that there is a benefit to, if you can prove a benefit early on, and societal support, and peer group support.
And habit.
Right, but if you introduce all those early on, 0 to 5, you're going to achieve it.
Yes.
Because I cannot think of myself as an example. I grew up in a refugee neighborhood in tents, in a country that was all called Palestine at the time, and it's called Israel. And I went to school with refugees from Western Europe, children who had, coming to school in the morning and being deloused with DDT so we wouldn't have bed bugs, and being fed by the teacher as you walked through the tent classroom and got a spoon of cod liver oil furnished by the American Red Cross. So, and I made it. Was I lucky? Was it because of my parents? Was it because of the value system? Was it because everybody else was in the same boat at the time? And we didn't have iPads. We didn't know what iPads were. We hadn't even heard of fax machines. We knew Xerox machines. So these are some of the questions we're going to talk about. But let me get back to the study, because I think the crux of the issues of my show here, Boritzer's Bio Briefings in Hawaii, is particularly relevant for the obesity, diabetes piece. And what we found out was that we also may not be able to incentivize in terms of eating behavior or even exercise, but maybe by example and adopting some of the native Hawaiian behavior, we could do something. So I'll show you what we did. Maestro, do you want to put on the video, the 3-minute video? And this is what I came up with.
Okay, you got everybody?
Yeah,
Okay.
we got everybody. Okay, let's do it to it. This is an attempt to make exercise and fun
Play this last time.
synonymous. Okay. My name is Professor Rafi Boritzer. We are here on Sugar Beach. We're at the Maui Canoe Club, which is on the south side of the island. Today we are going to take for the first time the wide body canoe that I designed about a year ago, specifically to be used for obesity reduction and prevention of chronic illness. I know it's a little bit of stretch of the imagination, but we have a theory that if people exercise in something that they like to do, especially in Hawaii, where many of the Hawaiians simply do not fit in the canoes that they came here 1,000 years ago. We want to recreate the times that they can get back in the canoes, paddle, and keep in the shape that they were able to survive all these years on these islands. Hawaii is one of the highest populations of diabetes-prone and diabetes-inflicted populations. And we're trying to reduce that through exercise. Some imagination and support from people who never thought that this could be a weight reduction tool. A grant from the Centers for Disease Control. Also took the support of the University of Hawaii, Maui College. Most canoes are about 16 to 18 inches on the seats. Maria, could you take number 2? Bruce, number 3. The average person can fit in with no problem, but people who have obesity issues or wide girths and so on will find a problem to get in. And so I specifically made sure that the 3 canoes that I'm using for this particular application will be at least 2 to 4 inches wider to accommodate most people who will be able to get in and out of the canoe.
Anyone can show up and paddle with us. We give them some safety training and basics on how to paddle, and they go out with us every day if they want. It's a fun way to exercise. It's a way to just go out and kind of be at peace with the world and get the day started.
It's so soul-filling. You get to work hard with 6 people, get to enjoy time on the water, and it's virtually 100% quiet and tranquil.
The grant that we have from the Centers for Disease Control is a 2-year grant that will end in April. Together in a collaborative relationship and a strategic alliance with the Maui Canoe Club, they will continue this program for at least the next 3 to 5 years by having use of the canoes, and they will volunteer their time. Thank you very much.
Thank you, Rafi.
Thank you, Luke. Thank you. Thank you. So what you saw was actually our second issue in the research was how do we engage the obese and at-risk population in meaningful physical exercise, thereby reducing the potential of costly and debilitating chronic illness. So we're going to take a pause because we're going to go really into depth on this next week with one of our molecular biologists at the School of Medicine. We'll take a pause here before we continue. Thank you, Maestro. Take her away.
I'm Hong Jiang, host for Asia in Review on Tuesdays.
And I'm David Day, host for Asian Review on Thursdays. Both of us broadcast our respective shows at 4 p.m.
And my topics tend to deal with questions related to environment, culture, history, and sometimes human rights.
And my shows tend to be on international business, foreign policy, geopolitics, and national security. And you can watch our shows live on the ThinkTech website at thinktechhawaii.com.
And you can also watch us on YouTube or Olalo.
So come join us on Thursdays at 4 p.m. I'm David Day.
And on Tuesdays at 4 p.m., I'm Hong Jiang.
Aloha.
Aloha.
As I said, just to give you a preview of next week's show, we're going to be having Dr. Rich Alsop, who's a researcher in telomeres. Now, telomeres are part of a gene structure that can actually predict your longevity. And Dr. Alsop and myself are teaming up to do research along the lines of actually measuring and seeing if any of our proscription and prescriptions for reducing obesity and reducing the potential of chronic illness can be measured after interventions such as dietary interventions and exercise interventions. But that's next week. Let us continue. We repeatedly mentioned ethics. Ethics is a very critical component of social behavior, and it didn't just start last year. Ethics have been around for a while. Ethics became an issue in religions, whether it was the Catholic Church, whether it was the time of Maimonides, Jewish philosopher in Egypt, whether it had to do with social systems. Ethical behavior is always at the crux of political and social decisions. And in the medical ethics, they are particularly facing many, many issues as a result of technology, as a result of longevity, as a result of miracles, if we can call them that, by the pharmaceutical industry. But there's often discussions about what happens when there's an argument in keeping someone alive, or on using a new today medicine that possibly could prolong life. We just saw this past week, we saw an issue where a woman apparently a hospital mistakenly thought that they were obeying the law, keeping a pregnant woman alive who had been brain dead already for several weeks because the hospital feared political retribution or perhaps judicial decisions that could put it in jeopardy financially and politically. So they decided to keep a woman alive who's with a damaged fetus, possibly not viable even, and a dead person. The issue came down to, can a dead person make a decision on keeping a fetus alive? I mean, that's a big stretch. So that's one of the issues that have to do also with the ability to keep brain dead people alive. I mean, this is a very new phenomenon. As a result of certain pharmaceutical interventions, a result of electronic interventions, diagnostic interventions. I mean, even the issue that would seem to be so easy to define, what do we mean by death, is not so simple at all. It used to be very simple. The medical examiner or physician came to your house and said, your wife, your daughter, your father, your mother, the cat expired, and I'm issuing a death certificate. Well, that's no longer sufficient. A death certificate in and of itself is not sufficient reason to believe, according to certain circles that the person has actually passed away or died. Another issue that's facing, we're going to be discussing in terms of ethics, is the challenge to public health care. Waiting for care. We saw just this week again, you know what, we can talk about ethical decisions because they appear every day on television. They appear every day on the internet and in the newspaper. We can't get away from them. What happens when a person doesn't get care? Just in Hawaii this week, a person was waiting in the emergency room 8 hours and passed away and died from waiting. What do you think that is? Is it just scarce resources? Is this something that only happens in America? Well, let me make you feel better. If you want to be compared to Pakistan, where I worked and lived for a while, I'll tell you how it works in Pakistan. In Pakistan, if you have money, you go to the university hospital in Karachi or in Islamabad or any of the big cities, no problem, you'll get all the care there. But if you're in Lahore and you're poor, as I got to see with a hospital, St. Thomas Hospital, I believe is the name there, has nice grassy knolls, just like the Texas School Book Depository. Nice knolls stretching from the building grass. And what do you see on the grass? Perhaps 1,000 people with little blankets with 4 poles holding up and like lean-tos, like small tents, protect from the weather, waiting for admission to the hospital. Waiting 2 to 3 weeks to get into the hospital. So you think, okay, well, 2 to 3 weeks and it's not so bad in the summer. Well, let me tell you something. Lahore in winter is very cold. It's like the same as somewhere around Chicago and perhaps the mountains of Colorado. So it's not a lot of fun waiting to get into the hospital. But what do you do while you're waiting there for the admission? Your friends and relatives bring you food to eat and medications. Because even once you get into the hospital gives you nothing except the service of the physicians and the nurses. And you have to pay for your own medication. So what do you do if you're a poor person? Those of you who are, I know that I have some people who believe that the Affordable Care Act is a mirage. It's something devised by the enemies of America. Well, let me tell you what they do in Pakistan. You have to bring medications for your relatives. And if you don't have money to bring the medications, there are volunteers, like the Red Cross ladies. And they go to pharmacies and pick up all the out-of-date medications that have to be thrown away by law. They pick them up, and then they will give it to the poor people in a hospital. Sometimes the medications are 5 years old. Sometimes they're only 2 years old if you're really lucky. And then there's food. There's no food in many hospitals, just like there's no food in prison in Indonesia if you're a prisoner. You have to provide your own. So when you're in this hospital in Lahore, your relatives bring you food. Now, this is just the good news I'm telling you. Now let me tell you the bad news is, when you get admitted, there are 2 possibilities. Either you will share one of the beds with another patient, or if he has too many tubes perhaps sticking out, you will be under the bed on a cardboard in the hallway, because only paying patients get to be inside the rooms. So ladies and gentlemen, this is not just a story. This is not just a horror story. Pakistan is one of the good places compared to if you go to Africa, if you go to Sudan, if you go to Somalia. I don't want to describe you the hellhole. You know, someone just showed me a horrible picture yesterday on Facebook, one of my contacts. And she's a local girl, and she showed one of the pictures of Sudan. And I recalled, okay, that I lost my innocence in the slave market of Sawak in Sudan. This was 1998. So things have changed in many places. Some things are changing, thank God. Some things are getting better and better. We can look forward to a great future. America has resources, talent. We need more education, more socialization, more child rearing, more caring, and more empathy and sympathy. We're going to be discussing a lot more. You can tell I won't be shut down easily. It's very tough to keep me quiet. So I'm going to be talking nonstop. I'll see you next week. Until that time, this is Rafi Boritzer, my guest Jay Fidell. Thank you so much for joining me today. Being a provocateur, agent provocateur, which is really a good role and important for me. Until next time, Rafi Boritzer with Boritzer's Bio Briefings. Be here,
or not?